So why is someone in Africa more likely to have HIV and AIDS than a person in the US? I think that it's a combination of living in an area of poverty. In more impoverished areas, there is definitely a lack of resources, a lack of available education. A lot of it comes down to not being able to adequately prevent the spread. People don't know what it is or know how to treat it, and because they're not really given any information, they're not given the resources needed. They don't have government or local community involvement. There was one of the TED Talks by Emily Osler. She brought up a really interesting idea that I kind of tend to agree with that some of these areas that have larger incidences of HIV and AIDS also have larger incidences of things like malaria or other maternal mortalities. If you look at the areas that have large incidences of malaria, what are the problems that they're facing there? Lack of knowledge, lack of community resources, lack of government help. Malaria can be stopped very simply by proper education and having resources, the bed nets. And so I think it does show a strong correlation. I think it's very interesting. I also do think that geographic origin can affect you. And again, I think it comes back to poverty and lack of knowledge and education. If you grew up in a place where people aren't teaching HIV and AIDS prevention techniques, you're not going to know what it is or how to protect yourself against it. I also think that in areas where there is less money available for the needed resources, that can become a problem as well. I do think that social class and socioeconomic status can affect the likelihood of someone contracting HIV or AIDS. Again, I think it all goes back to the knowledge and resources. Those who live in areas where more money is available, you are more likely to find resources and support. Schools that have early education programs to know what HIV and AIDS are and how to prevent it. Those schools need money for that education. In places of higher socioeconomic status, you're more likely to find the money needed for these resources. A program that I found that is working to implement the stop of the spread of HIV and AIDS is something called Save the Children. There are approximately 3.4 million children currently living with HIV or AIDS. Save the Children's focus is on areas, sub-Saharan Africa, and then they're also moving towards help in places like Haiti and some parts of Asia. They have a couple of different programs available. One program is in Ethiopia, and it's called the Positive Change Children, Communities, and Care Program. And they're working here to build a foundation on community mobilization, getting the community involved in the care and support of children with HIV and AIDS, and then also helping to strengthen their knowledge in prevention. Another area that they're working on is with at-risk youth in Asia, and they're targeting high prevalence areas. They're working to give more access to quality information and services and establish peer support networks So they're trying to make the information youth friendly, so youth will naturally want to make healthy decision and adopt protective practices. And then they're using the influential adults, peers, and even like religious leaders to help increase their knowledge to create healthy behaviors. And then lastly, an area that they're working on is with mother-to-child transmission. And that is teaching mothers that it's okay to get tested. I guess there's a huge stigma barrier that comes along with having HIV and AIDS in Africa. And so mothers are not getting tested because they don't want the stigma that goes along with it. So they're empowering mothers to want to get tested so that they have the knowledge and support available, and then also working with them to continue follow-up care, and then also working with the community to enhance support of mothers who are HIV positive. So I think it's a really great organization. And that's it. Thanks.